Hello, changemakers. This is the Dr. Kyra Show, where we use science to change ourselves, others, and the world. Today I want to talk about the difference between a behavior and a habit. This is something that was not obvious to me even after decades of trying to change patient behavior, my own behavior, my kids' behavior, the world's behavior, or whatever. A behavior is something that you do a single time, whereas a habit is something that's every day. For example, my mom, unfortunately, was diagnosed last year with diabetes. She had come to stay with us, and I noticed that at night I kept hearing these noises, and she kept getting up multiple times a night to use the restroom. So I asked her about it, and she said, well, I guess it's been getting worse. I didn't really notice it. And I said, Mom, when you get home, you need to see your doctor and you need to get diagnosed. And sure enough, after a lot of procrastination for about 2 months, she finally went and she was diagnosed. So when she leaves the prescribing physician, that doctor visit, what happens is that she has a long list of behaviors. Go get a prescription. Go ask the insurance whether it's covered. Go to a diabetes education course. Those are all single behaviors. But what has to happen daily? Daily, she has to change her food habits. She has to test her blood sugar, and she has to take her medication. So that's the difference between her previous life and her new life. And once you know that you have habits to design for, that's a very different approach. For example, habits only happen with 2 things in mind. They have to have a routine that they are part of. So usually they happen before something, like before bed, you brush your teeth, or with something. With breakfast, I take my medicine. And that's the way the brain understands a habit. And that's how you design a habit differently than a behavior. So what I did with my mom is I sent her food kits where she got to eat really good, tasty food for about 3 months. And that was enough to get her familiar and have a new habit around food of what she was eating so that her brain recognized a different type of food as tasty. And now, to this day, she just went to the doctor as a follow-up and has a hemoglobin A1C of 6.3, which is very, very good and very healthy. So I hope this helped you to figure out if you're designing for a behavior or if you're designing for a new habit change in your life or in the life of somebody else, and that you're going to be more successful by seeing it this way. So if you liked this kind of tip and it helps you, please subscribe to the Dr. Kyra Show down below. And if you leave a question or comment in the comment section, I promise I will respond. I'll see you next time.